Guys, it's Tuesday. That means that we are girl talking, and today's topic of discussion is something that many parents are concerned about for their young sons, their young daughters. And here to tell us more about it, we're talking to Dr. Celyna Delgado from the Institute for Women's Health. Thank you for having us.
Thank you.
What are we discussing today?
Today we're discussing human papillomavirus and the vaccination Gardasil.
Okay, so HPV.
HPV.
Tell us what it is.
HPV is a large group of viruses, most of which do not adversely affect us, but we're concerned about high-risk HPV. And the high-risk HPV can cause genital warts and cervical cancer.
I see, and that's where their vaccines are coming in.
Correct.
Our one vaccine, and what is that?
The vaccination is called Gardasil, and it provides immunity to 4 of the high-risk HPV viruses, most commonly associated with genital warts and cervical cancer.
Okay, well, you know, Gardasil is a topic for discussion, especially with parents who are contemplating getting it for their kids, and it might have sometimes bad connotations, it might have some myths. Let's break some of those, especially the myth of kids fainting or even passing out. What's the case?
The reported side effects do include dizziness and fainting, but that is not an adverse reaction which would prevent continuing to receive the vaccination. You just take precautions to try to avoid the fainting.
Very good to know. Well, you know what? I really wanted to dive into this talk, and so we reached out to some of our viewers on Facebook to see, hey, do you have any questions for a doctor? We have a few. Can we ask you?
Sure.
Okay, very good. So I'm going to go to Facebook, and Maria Maldonado, she says, is there ever a case where you will not recommend to get the vaccine?
The only situation that I can think of where you would not want the vaccination is if a child is allergic to yeast. That is a contraindication. However, I can't think of a good reason not to get it otherwise.
Good to know. She also wants to know if there's any other types of vaccines.
There is one other type, but it only provides immunity to 2 of the high-risk viruses, so Gardasil seems to be the preferred.
Okay. And Maribel she says, you know, my older daughter has the vaccine, but now it's time for my younger daughter to potentially get it. She's a little worried. Should she be?
In my opinion, no. I plan for my daughter to receive the vaccination, and I've already discussed that with our pediatrician, and most of the pediatricians and family practitioners are including it as something that they recommend.
Perfect. Great. I'm sure the viewers at home will be very excited about that. So, always recommend it.
Yes.
For boys and girls.
Boys and girls.
How about an age limit?
Between the ages of 9 and 26.
Good to know. Great information today. Thank you so much for having us.
Thank you. Absolutely.